I'm your host, Janice Matui, and this is A Sit at the Table. A Sit at the Table delves into the intricacies of professional skills and emotional intelligence, offering insights on how you can thrive in the present and ensure long-term relevance. Serving as a gateway to mastering today's evolving professional and business landscape, our focus is to equip audiences with the necessary tools that ensure they thrive in the present, but also secure enduring relevance in the future. So join us, like and subscribe, A Sit at the Table, only on YouTube.
I think leadership in healthcare, automatically in our training as doctors, we are basically trained as managers, because I think in the ladder of healthcare, we are right at the top. So all of us have this responsibility to be the team leader or the captain of the ship. And so we have to be leaders whether we like it or not. Sometimes you are thrown into the deep end as a leader, or you are a reluctant leader, but a leader nonetheless. So in everything that we do, remembering to take the lead, let's have passion for what we do. Your passion in the work that you are doing makes it less of work and more of just a part of you. Like, I have such passion for my work that I don't feel it as a job. I miss it when I leave at the end of the day. When I'm on leave, I look forward to going back, because it's part of me as a leader. That passion stirs me to explore what your thoughts are, who you are as a patient, what can we do for you as a facility, as an individual. And having a patient as the center of our practice, or everything we do should be patient-centered. That said, a leader should embrace the team, starting from the immediate subordinates right down to the last, or the one who has the lowest responsibility in the team. The one who does the cleaning, the one who does the cooking, the one who does the nursing care, the one who is going to do that brain surgery, or that delivery. We are at par. We are one. We move as a unit. I can't operate with my arm behind my back. If my right arm is a theater nurse at that point, I can't do it without you. Okay, perhaps I can do it, but I can not do it as well as. So the outcome will be compromised if I don't have you. This is medicine. I can't do it alone. I could do it, but not as well, not excellently. So if you recognize that as a leader, let each person know their value in the team. Each person know they're appreciated. Because if I know I'm appreciated, I'll give my best shot. And we're giving this best shot for the patient. So listen to your team. Support your team. Know your team. Perform with your team. Because I am the head of department in obstetrics and gynecology, doesn't mean I cannot make a cup of tea. Doesn't mean I cannot bathe the patient. I've played all those roles. And my team have seen me do all these roles. And therefore, they should do no less for my client. We expect perfection. We are human, so it won't be perfect. But we expect at least excellence. And at the end of the day, we should pick up our coats, pick up our instruments and say, we did well here. We did our best. Because that's the best we can do. So as a leader, always embrace the team spirit. If you find yourself doing everything by yourself, you are failing. remember, we are parts of one body. The body can work by itself. In some way, I can do a surgery, or I can do a delivery with one hand, but I'll do it better with two. So each part of that team, what am I if my environment is filthy, if it's loaded with infection? What am I? Nothing. What am I if my patients are hungry? I'm nothing. I'm part of an experience. So recognition of this, I think, will make leadership in our realm go a step further. The medical provision, medical care provision, needs a leader. It needs talent. But again, the leaders who are there currently in our day-to-day, I want them to remember one thing. Don't lose yourself in your leadership role. Don't lose your talent. Because I'm heading a unit, I shouldn't lose my practice. I should still be very hands-on, but I should pace myself in my service provision. But I should not lose the core of my being in that part of the whole. So a young medical practitioner, when you're done, you do your internship, basically apprenticeship. Okay, we have 7 years currently in our setting to do our medical study, and now an additional 1 year, 2 years of apprenticeship to master the art. No one ever really masters it. You learn something every day, I kid you not. Every person who walks into your office is a new story, and that's why it's so interesting. A new diagnosis, a new angle, same condition, different body, different dynamics. So in your day-to-day life as an intern or as a young doctor seeking to learn your strengths, pay attention, learn from the least and learn from the most. Don't think that you cannot learn, from every member of the team. I remember in some days of internship, there are some ward attendants who assisted us to cannulate in the most difficult cases, and that was amazing. Those who took time to learn the skills from these people still have them today. Those who didn't and thought they were too good, that was their loss. Take time to learn from everyone in your path. But remember that we all have different talents and skill sets. If I want to be an orthopedic surgeon, I like it. But my strength is in gynecology, is, in women's health. I just like orthopedic surgery. But every time I'm putting bones together, I can't put the bones straight. I must understand that that is not my forte. You have to identify where your strength is lying. And this you will learn in your life's journey. If your strength is in public health, so be it. There's no shame in leaning into your talent, because that's where you'll be the strongest part of the chain. Remember, I said we cannot do things alone. I can't complete my picture without physicians, without nurses, without sonographers, radiographers who do the scans and who do other things. I can't complete my picture. But those are not my forte per se. I know where my strength is, and that is not their strength. As life and time would have it, my own personal life and experience literally pushed me into the door of obstetrics and gynecology. And I enjoy it there. I think I had either wanted to do pediatrics, that's children's medicine, or obstetrics. But as time and experience would have it, I applied for obstetrics, and I was accepted there. It's a competitive field, but here we are. Listen to your inner strengths. Listen to your instinct. Because from your talent will manifest your performance. Okay? That's how you know. No one will particularly tell you, do this, or force you to do this. But sometimes you don't see your own strengths. That's where listening to others comes in, because they'll see your skills and talents where you haven't seen them yourself. So as a young doctor starting out and going out into the world, keep your eyes open, keep your ears open, keep your heart open, and let it all in. Be in no rush. Even if you were one kind of doctor and later evolved to be another kind of doctor, as long as it is your passion and you are performing to the best of your ability well, then this should speak to your career path. Work-life balance, if there is such a thing, is give and take as usual. Give and take with special consideration for your boundaries. Okay? Boundaries are necessary for personal growth. Boundaries are necessary for healing, regeneration, rebirth. Without them, you will just not achieve success in either realm. I know sometimes, you know, your partner, your husband, your kids, your work, everyone wants a piece of you, but you need some me time. You need some time to, you know, just go into your cocoon and come out as that strong butterfly from time to time, you know. Boundaries recognize that I am me and you are you, and we respect each other. And this is the essence of work-life balance. Just know that I am me and you are you, and we have boundaries. I respect yours, please respect mine. But this comes with communication and time. My favorite hobbies are fishing, and I love road trips. I love to drive off into the distance. It's a bit more difficult nowadays because I need to stop and have a nap every now and then. But yeah, I love my road trips. I love my vacations. I love to see happy people around me. And with fishing, it's the solitude, because you need to be quiet when you fish. Now, people who know me just know me as a chatterbox. I was always on the noise-making list at school. But solitude, I like also to speak to myself. And that's why I like to fish, because everyone has to be quiet for the fish to be caught. I don't catch much, by the way, but I like the process. I like the process, and it's a time for me to just recuperate from day to day, because obstetrics and gyne, it's a unique field. You know, it crosses very personal thresholds, and so the two things that I like that involve solitude and driving off into the distance in my jalopy. They make me happy. They make me happy and make me look forward to another day to be me, the gynecologist, me, the mother, me, the wife. So those are my few things. I also like to cook. Disclaimer, I'm not good at it. I like watching the cookery channel. That is like, I can do that for a long time. If wishes were, if wishes were horses, beggars would ride. But when I do take time, people are always appreciative of my cooking. I think they are very polite. But those are the three things I like to do most, apart from being there also for other people. I assume that, our mission in life is essentially, if we can make a day brighter for someone else, so I make it a point. Do one thing one day to make someone's day worthwhile. Just someone appreciate that I'm glad I'm here, and she made me realize that it's good that I'm here, make the day better, then that's true. So those are the things that I like to do. One book which, there are three things basically. The first is a book called Changes That Heal. Changes That Heal really made me interrogate myself. It's very difficult to create boundaries between how far is my work getting into my personal space and how far am I allowing myself any personal space? Do I have any? Previously, when I'm asked the question of, what do you do in your spare time? I said, I don't have any. I don't have spare time. Okay, do you have a hobby? Not really. But with Changes That Heal, which also comes as a seminar at the church that I attend, Miracle Life, it helped me to integrate, really to question myself and interrogate myself about what I allow myself to be, what I allow others to do to me, and how it affects me in terms of, am I cutting myself enough slack? Am I giving myself enough space to eat, sleep, learn, play at all? So the boundaries in life that we have, some of them are marred by societal expectations. Because I'm a Christian or because I'm in a religious belonging, I have to do this even when it means hurting myself. I must sacrifice to be on every committee in Lusaka when I have no food on my table. And so this interrogates what we take or what we accept as the norm and twists it in such a way that it knocks the air out of your lungs, literally. I think I read that book last year or the year before, and I'm not very young, hey, so it's a bit late to be discovering this, but better late than never. So I'd recommend it. I'd recommend you to look at the book Changes That Heal. The next one is You're Worth the Fight. This book was written by a patient of mine at some point, Louise Mupeta. Now this young lady is remarkable, strength and resilience. Her writing is quirky. I find time to read it every now and then when I have a moment. Granted, my life can be busy, but I make time because I need to. The writing is personal. you can identify, because society paints the sky blue, it paints the trees green, it paints situations black or white, and you find yourself in a gray. This book will help you understand that you can be who you are, and you are worth something. You are important, and it's okay to not, not always do things the way you are expected to do, not always feel things the way you are expected to. And even in some settings where my beliefs say I should be strong, but in this instance I am weak, there's no shame in that. So it's a must read. It's a must read. I think I read this book because I saw, I was encouraged a lot of times to buy this book and read it, but I took my time. I take my time quite a bit. But once I started going through it, and it's a journal, there are parts that you write down and fill. Now, writing down your thoughts and, your feelings really helps you dig deeper in there and make stronger resolutions than just doing things in your thoughts. So must have, this book is widely available in most bookshops. I think even online it's available. You Are Worth the Fight by Louise Mpeta, and it's a life changer, game changer, totally. The final thing that I enjoy listening to, and I listen to these things when I'm going home and when I'm driving home at night. It's very quiet. It's quieter than during the day. Is the Urban Evangelist. Now she's similar to my now they're friends. I think all my patients leave as friends. I think that's a little wrong, but she's quirky, and she's very practical and to the point, very truthful in her approach, but sticks to what is the word of God saying about a certain situation. We live in a society where situations can be twisted to suit how you feel in that particular instant. But I love her blog, and I take time to listen to what I can, and I would encourage you to do the same. I think it's so refreshing and uplifting and encouraging in our day-to-day journey. Life is hard enough. You need literature, you need blogs, you need encouragement. Even ASATT at the Table is one of the blogs that I follow and listen to. I find it on YouTube, and I find listening to people who I ordinarily would never had the chance to sit at the table with, learn and sit at the feet of a master in economy, in health, in so many fields. This is a forum for you. And if you are a young person out there, you are starting your career, we didn't have things like this. We didn't have resources. We didn't learn. We learned from our own mistakes. We learned from, picking ourselves up, if we manage to pick ourselves up. But resources like this are things that are, will push you a step ahead, give you insights that you never had, build your life differently, because you are learning from the masters. And it's there on YouTube, it's there on other fora. Take time to listen and learn. It will make your life so different. I really appreciate it. In my age, younger, all I knew is get your salary, buy bread, buy this, do your shopping, no planning. It's now that I'm older and I'm learning all these things, I'm close to retirement at this point. But better late than never, right? So I encourage my kids to listen. I encourage them to attend seminars and so many more things. These are free resources. So if you can, please check in, listen, learn. Thank you so much.